Case Study Part 2. 24-year-old white female patient sees the gynecologist for her annual Pap test. First, the nurse asks her to give a urine sample using the clean catch urine technique. The patient goes into the restroom with the sterile cup, washes her hands and sits on the toilet spreading her labia. Wipes her labia and uses another wipe to clean over the opening of the urethra. While keeping her labia spread open, she urinates a small amount into the toilet and then fills the cup halfway with urine. The nurse then takes the urine sample and runs a pregnancy test. While waiting for the pregnancy test, the gynecologist performs the Pap test on the patient. During the test, the doctor uses a speculum to widen the opening of the vagina. Now the doctor examines her cervix and vagina. Cells are collected and tested for any abnormalities. Next, the nurse comes in with the patient's urine sample results and finds that the patient is pregnant. After a few weeks, the patient goes back to her gynecologist to have her first ultrasound of the fetus. Because it is the beginning of her pregnancy, the doctor uses an ultrasound wand to go transvaginal to look at the cervix and fetus. When the fetus is more developed, the doctor uses an ultrasound outside the pelvis. At 6 months, she starts to have a fistula. The doctor recommends bed rest for the rest of the pregnancy. At 7 months, the mother's water breaks and she starts to go into premature labor. She gets rushed to the hospital and she goes to the maternity ward. After the obstetrician examines the patient, they see that she is fully dilated and that the baby is in the breech position. The doctor takes her to the OR where he performs a cesarean to get the baby out. They get the baby out fairly quickly and take him to the NICU. After 2 months of intensive care, the baby is healthy for his mother to take him home. 35-year-old African-American male is brought into the emergency department after being struck by a car while walking across the street. He is unconscious and has an open compound fracture of the leg. Because of this, a cast can't be used. Instead, the orthopedist uses external fixation. Once that is in place, the MD takes him to get a CAT scan. Looking at the film, the technician finds there is an intracranial injury or TBI. They find there is a contusion.